Good afternoon, everyone, and welcome to today's webinar. Today's topic is a manufacturer's guide to producing personal protective equipment and supplies needed in the fight against coronavirus. Before we get started, I'd like to take a moment to go over a few housekeeping items. My name is Allison, and I'm the webinar organizer for today. We want to make sure today's presentation is extremely valuable for you, so we ask that you submit all questions by clicking the question button in the control panel and typing your question there. Right now, please join me in welcoming Michael Lalich, Director of Business Growth Services for the Greater Cleveland Partnership. Michael?
Hi, I am Mike Lalich. I'm with the Business Growth and Development team here at Greater Cleveland Partnership. Thank you, everybody, for joining us today on our webinar, where we will be discussing the statewide effort that's underway to help manufacturers retool and transition to supplying essential protective equipment and medical supplies that our healthcare providers desperately need. Today's webinar is part of an organization-wide response by GCP to help businesses connect to resources and information that they need during the coronavirus pandemic. Our advocacy team, for instance, is working very closely with state and federal officials to update the local business community on all the latest government policies and programs. You can check this out on our website at Greater Cleveland Partnership's website, where we have information about available financing through SBA Disaster Relief Program, the Paycheck Protection Program, which recently came out in the CARES Act. So that's actually a partially forgivable loan program, as well as a toolkit for unemployment or employers on unemployment topics. The Business Growth and Development team here, which is my team, we are also collecting feedback from companies that are experiencing disruptions due to the coronavirus pandemic. We have a survey on our website, which is gcpingear.com. So if you are looking for resources and want to talk to somebody from our team, you can fill out that survey and somebody will get back to you in a day or two, and we can go over your specific needs and see what resources might be able to help you out. So for today's topic, we are joined by Ethan Karp. He's the President and CEO of Manufacturing Advocacy and Growth Network, also known as Magnet. Magnet supports Northeast Ohio manufacturers as the region's manufacturing extension partnership office and helps companies on a variety of topics ranging from operations and process improvement, sales and marketing assistance, as well as product design and development. Magnet has taken a big lead on this new statewide initiative called the Ohio Manufacturing Alliance to Fight COVID-19 that aims to help manufacturers retool and transition to making protective equipment and supplies that we need right now. So I will be sticking around for the rest of the webinar to follow all of your questions as they come in and bring those up along the way. Hopefully we'll have some time to answer those at the end. And with that, I will hand things over to Ethan, who can talk about more about the statewide effort and how companies can get involved.
Excellent. Welcome. And thank you, everybody, for being on the line here. So I'm going to tell you all about this initiative. I'm going to tell you about where we are in products. This is real time. Things change every single day. I'm sure for some of you, and certainly for our healthcare workers, this crisis is around the clock. And I can tell you, we've probably also been working around the clock to try and find manufacturers who might be able to provide that critical PPE, the protective equipment that just is in short supply across the entire nation. So I'm going to make sure that I am sharing my screen. I believe you can all see this. And I'm going to walk through a presentation, but I really would love if folks have questions to be sending them in while the presentation is going on. And I will attempt to see those questions and actually answer them as they're going on. It doesn't just have to be about PPE. We are also sending around a lot of information about how manufacturers should prepare for keeping themselves safe. And frankly, any question I will try and answer, or I will get an answer for you. So here we go. And for the organizers, can you guys get my question? Here we go. Got all the questions. So if you send a question, then I should be able to see it. Okay. So want to talk about PPE, talk about keeping your plant virus free, talk about some other best practices we see, and a little bit of where you can find more information. So this all came to be when it was pretty clear that as this crisis was coming forward, there isn't enough protective equipment. And I can tell you all the different categories there isn't enough protective equipment, but it's mostly everything. And so we, the Ohio Manufacturing Extension Partnership, Ohio Manufacturers Association, Ohio Hospital Association, Jobs Ohio, got together and said, you know what, at a statewide level, with our partners like Greater Cleveland Partnership, how can we help manufacturers retool, repurpose what they're doing to be able to make the things, for example, on this piece of on this sheet. So this is last week going through where are the shortages in the supply chain, and all of the blue, the dark blue, are things that we're facing shortages. The light blue are things we expect to face shortages in. And where we really highlighted and looked at things was in this bottom left-hand side around gloves, goggles, gowns, masks, surgical masks, face shield, and as well as alcohol-based hand rub. That's another one that we've really looked into. And there's a lot of work going on across the state with a lot of these other pieces and across the country. Happy to contextualize all those other efforts because you hear a lot of them. So we started to say, well, how do we make those products in demand? So first of all, we said, look, we can try and find ready to go sources and hand them off to the hospital association and to the state. And frankly, most of those folks, if you have a ready-made product, are completely tapped out. That's the problem. So then we said, well, let's find manufacturers who are willing to engage on finding alternative solutions for those PPE. And the big barrier there is you've got to figure out, well, what does the product do? So it's one thing if the hospital says it needs to be made out of this plastic and this shape and FDA approved. Well, if that doesn't exist, the challenge was how do we go and we find what are the functional specifications that it has to perform to so that we could find an alternative. We then went with those alternatives. As we're finding them, we are engaging Cleveland Clinic, University Hospitals, others to say, does this make sense? Would you use this? Inevitably, in all of our product categories that we're looking at, as soon as we found an alternative, the supply of the raw materials for that alternative is gone. So how can we find different raw materials? And finally, there's a lot of outreach going to hospitals for this piece of equipment, that piece of equipment. How do we streamline all of that into an easy for them to access opportunity? This was the framework around what the Alliance was going to do. It's not just the Alliance that has a role to play in this PPE. While the PPE and other needed equipment needs to go to hospitals, frankly, there's a lot of other folks, nursing homes, firefighters, you name it. There's a lot of other people that need this PPE too. It's really this community effort. So you have the manufacturers who could produce PPE, the raw material suppliers who themselves may be manufacturers, largely are, but they've got to be available when the supply dries up. Then we have specific design alternatives that have to be created, and that's not so quick, that's not so easy, but maybe you could 3D print things, etc. There are national efforts to do all of this, groups like America Makes trying to say, we'll take all of the 3D prints from across the country and we'll vet them and find the best ones that you can actually use. And then of course, economic development organizations like GCP and Jobs Ohio and Ohio MEP and the state, all of whom are helping to coordinate these efforts, fund these efforts, connect people to these efforts, some of the many things that I'm sure you've seen GCP do for you. It's very much a community effort overall in this alliance. How we organized it is we said we've got a lead person who's working with the hospitals to understand everything that we need to know from them. We've got a lead person working with all the supply of manufacturers and trying to figure out what they could produce. And then we have an engineering team that goes between the supply and demand to create those alternatives, developing those new products, hacking or redesigning things, rapidly prototyping. We are squishing what normally would be done in a product development world from 9-12 months down into a matter of weeks so that we can provide the PPE before the peak hits and have more. We know we will never fill all of the PPE that is required. However, we hope to make a dent, and we know that every single piece of PPE that comes about is something that will save potentially somebody's life. And so it's worthwhile us doing. And for all the people that were out there trying to make their own PPE, even without our support, it does make a difference. So what we've been doing since we launched this is getting the word out that we can help retool if manufacturers have an idea. That part is important. It is very wonderful when a manufacturer comes to us and says, hey, I'm willing to help. But without a defined idea, there's just a low likelihood that we will be able to figure out exactly how that company that doesn't make PPE today will make PPE with the exception of sewing companies. There's a lot of these products that you saw were sewn. I'll get to that in a moment when I talk about all these different categories. So what happened to get the word out was the governor announced this initiative. And for all of you online, the most amazing thing here is that it is, something like 1,400 responses so far from manufacturers. I believe that the governor will be possibly announcing that right now, that there are 1,400 manufacturers who are actively getting engaged in this. And that's crazy. In a matter of days from the time that he announced it to now, to have that many manufacturers willing to retool. So we've committed to make sure to respond to every one of those manufacturers to understand what their capabilities are and find those that are pretty near to having an idea that could actually work as an alternative. And then what we do is we create broader teams around some of the key PPE that we think can be made by our local manufacturers so that we get some scale. So things like cloth face masks, hand sanitizer, face shields. Again, I'll talk about these in more detail. And then we try and coordinate those companies with the supply chains of the raw materials, which, as I've already said, is often the limiting factor when everybody in the country is trying to do something like this as well. At the end of the day, we have to actually get this in production. So we need to figure out how we're going to recreate supply chains very quickly. And of course, we need to bring in those detailed specifications so the manufacturer can actually make it. All of this is being done in the context of national best practices. I can tell you, if you want to pick me up story besides the 1,400 manufacturers that have reached out to us, the other pick me up story here is I'm a part of many different national networks. They're all exchanging information at a rapid pace. Have you tried this? What about this? States are exchanging information in ways that I've never seen. So the specific needs today, let me talk about some of the, and this is why I said this changes all the time. So let me talk a little bit about the products that we've gotten the most traction with. So face shields is one of them. And I see that there's a couple of folks on the phone here who are actually already producing the face shields. Excuse me. And they're actually working on this effort with us. So what we were aiming to do was say face shields is a plastic part. Let's source the plastic. We found plastic. And then we said, we need a new design for a head harness. So we designed a head harness to hold that face shield so that it was reusable, and then activated a network of manufacturers to come together and actually make those components. Our goal was to make a certain number in the next few weeks, which we believe that we will hit, but this truly, we're using 3D printing, we're using traditional methods of tooling. This is a very large effort, truly establishing an entire supply chain. We think that we've established it at such scale that with finding of more plastic face shield component, the actual clear plastic that protects somebody's face, we believe that we can expand even more after the next couple of weeks when the demand inside the state we've supplied. So that would be one example of sort of, we started with not knowing anything about it, worked with our hospitals, and then went toward the actual production. Now, the second set is we're looking for hand sanitizer. We've looked at, hand sanitizer, it's ethanol, it's a liquid alcohol. It's ethanol mixed with glycerin, typically denatured with something like isopropyl alcohol. This is the mixture. There might be one or two more things in there. This is sort of open source. By the way, the specification for that headband, we have it up on our website for open source. The specifications for how you make hand sanitizer is also up there. But there's a few constraints in making hand sanitizer. One, bottles. All caps with bottles are gone. Can't find them. So we've been working with bottle manufacturers to see if they can come online and make us some. Second piece is the ethanol that goes into, and the alcohol that goes into the hand sanitizer. That too has dried up very quickly. Now, fortunately, there are the distillers, and those folks have the capabilities to create the high alcohol content that is safe for hand sanitizer. Unfortunately, they don't have that much capacity, even in aggregate across the entire state, to meet the wildly expanding demands for hand sanitizer. If you think about the food producers that are going to need it, all the first responders, just ignore for a moment the hospitals who hopefully are getting supplied by Gojo and others. there's just this wide world. Probably you need more hand sanitizer. So how do we start meeting some of that need? Fortunately, we've had some success finding other sources of ethanol around the state. And then once you have the ethanol, once you have the bottles, that's why I put on here a specific need is high-speed bottling capacity, explosion-proof setup. So it's not enough just to have a high-speed bottler. It can't be a food or beverage producer because they wouldn't want to spoil their lines. It needs to be a bottler that has an explosion-proof setup. So we're looking at how to potentially build one of those locally. We're also looking at to see if there's anybody that has that capacity. I'm giving these examples so you understand the depth of complexity of retooling everything very quickly, but also that we're making progress and hopefully you guys can help out. So the next is gloves. So gloves is something that was long ago shipped overseas, the non-latex gloves, and dip molding, people that might make balloons is a way to do this. And so we are currently looking for dip molders who have an idea of how they could make the molds to actually dip for gloves. So if you have any, please send them to us. Our current pathway is to 3D print the actual molds to get them quickly made, and then they'll be dipping into the solutions that of nitrile, et cetera, that we hope to procure. One of the most challenging out there is material alternatives for gowns. So isolation gowns are the gowns that are often used for intubation. So a nurse or a doctor will walk in and will put on their gown for, say, 10 minutes, maximum of 45 minutes, intubate, leave, take off the gown. It can be washed. There are disposables, but let's assume that we're talking about the washable kind. Well, those gowns need to be water impermeable. And typically it's a polypropylene, and all the polypropylene sources are sucked up pretty much immediately. And we can't find it anywhere. Nobody can find it anywhere. So we're looking for material alternatives to gowns that would have this water impermeability. There's difficulty in that the supplies of fabrics that are available, one batch of fabrics is not the same as the other. So one may be impermeable, one might not be exactly impermeable. These are the types of complications we're looking at. What if we just use thin plastic? Can we make a shirt with sleeves? These are the types of things. We know we have tremendous sewing capacity across the state that through those 1,400 companies that have applied to us and told us what they're doing. We know that there's a lot of sewing capacity. What we don't know is what material we can send to them to use. So in your question area, if there's other things that have come up on your radar, we're also working on cotton swabs. N95 masks are particularly difficult because they require a very specific filter media, and that filter media is not something that is readily available. Very small because it can't let in the air particles. It's not safe to 3D print N95 masks. So that's why you've heard in the news a lot about places like Battelle, and this was such a big deal for their technology to be able to reuse the N95 masks, which are really the gold standard for keeping yourself safe. The shields plus a cloth mask are cloth meaning like a surgical mask, what you often see, the blue mask that doctors wear. That's the far second option, although that might be what people have to put on. So the N95s is another category you might hear. Obviously ventilators. The reality around ventilators, you guys can see in the news all day long, is for the actual core ICU level ventilators, it's a complicated piece of equipment. And you can look at the big auto manufacturers who have shut down and are retooling how much money and what sort of throughput they're seeing is a very hard challenge. Now there's a whole set of other ideas around not quite as heavy duty ventilator systems, so like CPAP machines, things that could help push air into your lungs but aren't as sensitive for the most dire cases as those rare other ventilators. But I think the reality is that we don't need to create new versions of those. We could buy more CPAP machines if we needed that sort of capacity. There are a lot of exploration of what are things that you could split valves and divert so two people can use a ventilator. How do you extend the life of ventilators? All those sorts of things are all in play. I don't have all the specifics on every one, but there's a lot of interesting ideas being explored right now by us and others around things related to ventilators. Again, in the comments box, if you had other specific questions about other categories that you've heard thrown around, I'm sure we've looked into them. I'm happy to talk about them. So for now, of course, if you haven't already, but I think you probably have, going to repurposingproject.com. That's where the link to fill out the form is to be able to try and have your idea be considered and us call you back and talk about how that can work. So let me pause there. Let's see, I don't see any other questions coming in specifically about this, unless I'm just not using the, yes, I am. Give me just 1 second. I'm gonna pop this out. Here we go. Ken asked if there are any suggestions on how to receive FDA waiver for production of masks. So I can give you a number at the end of somebody to talk to about what it would take. It depends what type of masks you're talking about. So like I said, the N95 masks are covered by a number of different agencies. The surgical masks, I think are covered, but I think there's been a lot of guidance on what you can use instead. So I guess I would ask what type of masks you're looking at and then suggest how to go about contacting the FDA. And we do have a few numbers. Yes, the plastic lens for face shields is what is in demand. It's a polycarbonate PET or PETG piece of sheet, preferably 0.02 thickness, could be thinner. All right. So I'm going to go, thank you very much for those questions and comments. I'm going to go on to a totally different topic unless others have questions on that PPE and talk a little bit about what people are doing inside their plant to prepare themselves. So keeping your factory safe has been a huge effort by most of our manufacturers. So if we consider that either because they're trying to do the right thing, which most are, by keeping their people safe, or simply put, if you have COVID come into your plant and you're not careful, your workers will be sick and not be able to come in. So either way you cut it, the fact is you need to have a safe environment. And this really goes against the grain of a lot of the lean practices and things that people have been doing. And so the top things that people are doing, I'm going to give you a smattering of them. And if you want to, in the questions column also, if you have other ideas that I don't mention, feel free. The biggest thing people, at least to me, one of the biggest things people are doing is splitting up their shifts. I mean, that's pretty difficult, right? Say you have 1 or 2 shifts and you go to 2 or 3. The point is you keep one group entirely together and you don't mix them so that if one group gets sick, the other won't. And then it gives you time in between shifts to clean everything. People are putting physical partitions up. People are spacing each other out and writing, putting lines on the floor and saying, this is your spot. People are separating segments of their entire plant, putting people here, people there, so that, saying don't go over into that area so you can contain from a remote location. People are finding those key individuals inside their companies who, if they got sick, their plant would shut down, your maintenance worker, and making sure that they are extra protected. They are extra, safe in wherever they are. If you have to go into the office and you're in an office role, people are not having in-person meetings at all. They're still doing Skype, even though they're in the same building, maybe separated by rooms. There is a lot of how do we remove common surfaces. So I've seen devices where people figure out how to use their forearm to open doors, how to remove doors, just keep them open, how to have protocols for wiping instrumentation down that you might have to pass between people. These are all of the sorts of things that people are doing, increasing ventilation rates, just really going through and figuring out how can we minimize contact and spread people out. Now, this has some psychological effects in people's plants and don't have a great solution other than acknowledging it. And that is that, people that like to talk, if you have a factory that has the ability to kind of chat, especially if you have a boring job to do, it eliminates their ability to do that. So really have to think of sort of in this time, especially if this goes on for a few months and maybe reoccurs if the COVID comes back or something like it comes back, that the really have to consider that the changes that are being made here need to be sustainable. So what's going on with the folks you're talking to, the folks inside your plant, to make sure that they are psychologically just as happy and engaged as they would be if they weren't separated. And these are not, of course, the people who are actually working from home. Lots of news about if you're working from home like I am, what sorts of things you should be able to do to keep your sanity. So those are just some of the safety tips. I'm curious if anybody else has questions. Those are sort of the biggies in mind. I'm gonna look at my handy dandy list because we scoured Korea and Australia and countries that have been through this. We've talked to manufacturers who have been through this. On Wednesday, Swagelok will be presenting on what they've done inside their plant on a webinar. So lots of resources out there, but people are having to very quickly change everything. Yes, people are doing the temperature checking. No, it's not a requirement, but it is encouraged. There are people wearing face masks if they can find them, and people can't find them. So if you can't find them, you're not alone. If you can eliminate all handoffs between people during shifts, of course, but just in general, how do you eliminate those handoffs? Closing common areas, kitchens, etc. And so those are some of the tips around how people are keeping people safe. And then lastly, what do you do if you actually get a case of COVID inside your plant? And I think that what we're seeing people do is, first of all, creating that SWAT team of your senior executives to be able to make the case-by-case decisions. There is CDC guidelines. You can go to our website, and I'll have that link later, to look at one lawyer's perspective on what those CDC guidelines mean in terms of close contact. But the idea of somebody's been in close contact, and that's not somebody walked by somebody who was sick, but somebody who was working near them in proximity for some period of time, that person typically is also sent home, and that area is closed down for a while and then disinfected. So you will need to have, and then you want to protect the anonymity of the person who got sick to the extent you can. So you wouldn't announce who was sick and who was going home, etc. Talking to people one-on-one would be the preferred route. And if you are in that scenario, you're going to have to make decisions pretty quickly about what happens, who is in close contact, and they're subjective in many cases. Of course, you probably want to err on the side of being careful lest it shut down your whole plant or other people get sick, but you're going to need that senior executive team to make those decisions, including HR, etc. Okay, so you can go to, like I said, our website, manufacturingsuccess.org/COVID-19. And those best practices I just mentioned are all in an Industry Week article on how to keep your employees virus-free at work. And then the manufacturing best practices for COVID-10, and it went back in time, I guess, for COVID-19 are written here. And then some CDC guidance. We have done a lot about the CARES Act and the Family First Act. All of our FAQs around what you should be paying people, how often, when do you have to pay people? Can you make them stay? Can you not make them stay? What happens if you're shut down? We've tried to answer all of those questions on our best practices page right here at manufacturingsuccess.org/COVID-19. So those are some resources that are available to you. And so now I would like to open it up to any questions about anything that might be going on that is relevant to COVID-19 and manufacturing. Hopefully get some questions here that perhaps Michael can call out, or I will read them off.
Yeah, I've got one here, Ethan. What's the timeline from healthcare providers that you're hearing right now? So say you're a manufacturer and maybe you can't make some of these things within 2 weeks, but maybe you could in 4 to 6 weeks. Is it still worth them pursuing trying to transition to making some of these products?
I think it's just a matter of risk. I think that I'm seeing mid-May, June is the peak. I don't know, these shortages are going to be there for a long time because even our peak does not necessarily coincide with others' peaks. And the more things that happen elsewhere, the more of this stuff is taken up elsewhere. So it might not be as relevant for Ohio, but I think it will be relevant for the country. Of course, at that point, if you're doing it just to donate it, do it. If you're doing it to sell it, need to recover those costs depending upon what it is you're making, I would say that you really have to consider in 4 to 6 weeks, what does the overall market look like? How many people have spooled up who started 2 months ago making things that are now available? So I guess my short answer is I have no crystal ball to say whether it will still be relevant. But if you're mainly doing it to help the world and help PPE, and you're willing to take a loss on it to make it happen, then I would say do it, because there's a good chance that people still will need this stuff in 4 to 6 weeks. It's a great question.
We received a couple other questions in here. One is, has anyone received permission to manufacture masks using HEPA rated 3.3 micron furnace filters? I don't know if that's
I don't know. I'm writing down the question.
Okay. Another one that I got is a big part of this is not just manufacturing these PPE products, but the materials to make them. So I think on the list, the list that you put up initially mainly has the products like the masks or the face shields. But there's a high demand for some of these materials that are needed to make these products. And you mentioned cloth, different types of cloth for both gowns, as well as some of the other protective equipment, and then also plastic, like the face shields. Are there any other really high demand materials that a company may have? They might not be able to provide actually manufacture some of these things, but they might have some stock laying around that they could contribute to companies that can't make these things.
Yeah, the contributing of the stock would be a big deal. Cloth, the clear plastic, like I said, polycarbonate, PETG, PET. If you do have those on stock, please email me right away and we'll chat with you. And we've got, so the cloth is a little bit more complicated just because we have to figure out exactly what type of cloth we want people to make things out of. But in the next few days, I hope that we launch an effort to make something, be it cloth face masks or gowns, out of material, and we'll be making an all call for people that have materials.
Got one question that kind of relates to cleaning some of these protective products. So have you gotten involved with that at all, and through the statewide effort on technologies to clean masks or clean some of these gowns, things like that?
My understanding is there have only been 1 or 2 that have actually been FDA approved, and that there are a lot of others that are in consideration. I know that the state is actually considering them. So I see some people popping in with these ideas. We plan to batch send these ideas that folks have to the state and the doctors that are looking at that, and potentially the Battelle team that has their own supply. I mean, the reality is that nobody's going to use it until it's FDA approved. But the state is interested in fast tracking anything that's ready to go and has all the performance metrics to show that they should be FDA approved, at least under emergency use. So, so if you're on that list, please go and fill out that form on repurposingproject.com to tell us more about what you have. There's 3 questions if you scroll down. So I'd highly recommend, please request that you do that so that you get into our system and our engineers will immediately start working up with you.
Yeah. So say you're a supplier, you make smaller parts that some of these, like a ventilator producer, could use. How could these kinds of companies get the word out to the kind of the tier 1 companies that are making the final product, that they have capacity to quickly produce some of these parts? Or how can they get involved?
We are creating a database that would have all of those and the ability to reach into it and ping it. The reality is that the folks, as I understand it, who are likely making the ventilators, Ford, et cetera, they're probably leaning on the supply chain that they already have to make those pieces and parts. But we want to be ready if they do need to ramp up quickly to be able to supply any manufacturer that they would need, because Ohio has all manufacturing and can absolutely provide anything that's required. So as of right now, we don't have any leads on, hey, this manufacturer could produce 10,000 more ventilators if only they had the supply chain in place. But we are looking for those opportunities, and I think we have a couple. I think we have a couple of leads on companies that we're going to ask this explicit question to, is whether they need more companies to fit in that supply chain. I see that somebody asked for, that somebody mentioned the shortage of caps for hand sanitizer. Yes, that's still the case. I didn't mention it. Thanks for bringing it up. Love that you're reading the email. The specs, there's no specs. At this point, it's something that is not a flat top, and we can't find them anywhere. So spray bottle, flip top does not need to be sourced here. Problem is everything from China is 12, 20 weeks out. And so we've not found a supply, but if anybody has a supply, then that would be fantastic, of closures for bottles that can be squirted out or sprayed.
One other thing, as we're ramping up to meet the capacity that we need in Ohio, Ohio is a large manufacturing state. We're lucky to have a lot of manufacturers who can produce some of these things, and kind of some of the coastal states that are also going to have high demand for these products, but might not have the manufacturing capacity to meet them. Are you working at all with some of the national efforts to send some of these products to other states and other parts of the country? And if a company has a ton of capacity to make some of these things, are there places they could go to get involved with some of those national groups?
I am sure that I can find buyers if you had supply of any one of these pieces. The reality is, I would not say it's dog eat dog, because it's not. But in our state, I think most people are focused on getting the PPE for our state. And there's little spot markets that have appeared, because the fact is all this stuff is global, but everybody could send infinite amounts of PPE to New York at this point, right? That's the level of, everybody could put all of their supply there, but that would leave everybody else totally unprotected. So it's definitely true. If you have a product to sell, you could get it anywhere you wanted it to go. But at least my preference would be, hey folks, we're gonna have the crisis here. Unless we've truly run out of the demand here locally, or you can produce more when we have our peak. We're really trying to focus on what it means for Ohio.
All right. Any more questions? We've already have offers then to make caps and dip glove tooling, so we're off to a good start there.
Yeah, thank you guys.
And so again, just to point people who, some people may have already filled out information on your survey, but again, where can they go to, send in their information and their availability to make some of these things if they want to get involved?
So if they want to get involved with the efforts and provide an idea, repurposingproject.com. And if you want just general information, well, it's not even general, it's pretty specific to manufacturing. We've tried to do a really good job of answering people's questions ahead of time. That is found at manufacturingsuccess.org/COVID-19, or just go to the main site and it'll link you right through it.
Great. Okay, last chance for questions. And just again, on GCP's end, if anybody has any additional needs for working capital or has some workforce questions, things like that, please fill out the survey at gcpingear.com, and somebody from our business growth and development team can contact you and talk about those specific needs. We did have one more question come in. I have suppliers in China and Mexico supplying these products. Can you help connect me with people that need them? So for importers or people that have access to products outside the country, are you working with them as well?
Yes and no. So the complication, thanks for asking. The complication with overseas importers, particularly for China, is there has been a tremendous amount of fraud and price gouging. And for an unvetted supplier, and Joshua, Jim, excuse me, I'm sure that you may know who the supplier is. The problem is that the hospital systems and any central purchasing that the government might do has a very difficult time vetting them, because there's been so much fraudulent crap that's come in. And where a mask might cost typically 50 cents, they're now $5. Some of that is because it's being air shipped, and I get that, but it's get price gouged, and you can imagine that now you need 1 million masks. Now you're $5 million out, and if you just bought a bunch of crap, very difficult. So that's the yes, we do, and please fill out the forms, and we would be happy to direct all of those requests into some central purchasing folks that we are directly connecting with. But just be aware that the response might not be overwhelming love, because folks can't decipher between your products and all the other stuff that we and others are getting offers for. Are there any grant funds for retrofitting? On a case-by-case basis, we are actually investing in people if they're in the product categories we're looking at. So if you have something that, for example, we've invested in some of the mold requirements for some of these products that we're talking about, et cetera. So if somebody has a product that's really close, I think that we could probably find the money to get them tooled up. I think it's a different story if you're asking for $20 million to create a ventilator, or $50 million to design your own ventilator. I think that those are all different bottles of worms, but that metaphor definitely didn't work. But they're different categories. So we can definitely provide with some help just directly, and that's why going to our website and including your link in there and talking about what it is you would need and what you think you can do is important.
How are companies figuring out pricing with healthcare providers on selling these products? Obviously you're trying to prevent price gouging of needed medical supplies, but also the manufacturers need to be compensated for the retooling costs and all of that. How are those negotiations going, and is this effort involved with those kinds of discussions at all?
So when we are involved, we are pretty much, most people I've seen are passing things on at cost. I mean, it's part of their effort to help out. I think that we have tried to give the hospitals a sense of, if somebody's retooling, this is truly what it costs them. Here's a reasonable price. I don't think people mind having a profit in there. It's just, when is it price gouging versus this is just how much it costs us to produce it. So I think in general, I'm seeing people produce and just bake in their fully loaded cost and say, look, it's at cost or near cost.
Great. Cool. Well, that looks like we've hit most of these questions. One more. Somebody mentioned specific a few times, UV sanitizers. We talked about cleaning some of these products, but is UV sanitizer specifically something that you touched on at all?
I don't actually have a great answer on UV sanitizers, except to say, like I said, Battelle had their different system, which wasn't, I don't believe, is UV. But I actually don't know enough about UV sanitizers to give you a concrete answer. I'm sorry, Joshua.
Okay. Great. Well, thank you everybody for joining, and thank you so much, Ethan, for giving us all this information today. Definitely anybody that's interested should follow up with him and his team and fill out the survey online. And then, if you have any additional things, follow up with us. But, we're trying to move quickly on all of this. It's been amazing having organizations like Magnet step up and help out on this. And we're definitely trying to work closely with them to connect companies that could take advantage of their resources. So thank you again, everybody.
All right. Thank you again to Ethan Karp of Magnet for sharing so much great information and insight with us today. Thanks to all of you for joining us this afternoon. We hope you found today's presentation engaging and informative. If you have any thoughts to share, please let us know. This concludes today's session. Thanks again.
Thanks, everybody.